So as you mentioned about glaucoma, and so I would directly come to that also, that
Yeah,
there are no symptoms for glaucoma, and it leads to serious problems later on.
true.
So how can as an individual we can know about it
Yeah.
and get treated at the right time?
Yeah. So glaucoma is also known as the silent thief, because what really happens with glaucoma is your central vision remains intact. So if you're looking at a point, you're seeing that point that stays intact till the advanced stages, but your field of vision starts narrowing and starts constricting. So when you look at a particular point, you don't just see that point, right? You see a whole field around that. And what happens in glaucoma is that starts constricting, but that's extremely difficult for an individual to be able to tell by themselves if that is happening. What is important is to get yourself checked yearly, and for every individual ideally, and for young people once in 2 years is also fine, but especially if you're above the age of 40, at least once in a year you must get yourself checked. And the only way that glaucoma can be diagnosed is by assessing the pressures in the eye, which can be measured with a machine that most ophthalmologists will have, and by looking at the nerve of the eye, because the nerve is what starts getting damaged. So what essentially happens in glaucoma is that the pressures in the eye are high, because of because of that, as a consequence of that, the nerve in the eye starts getting damaged. So in most cases it's a very gradual progressive deterioration of vision, and whatever damage happens to the nerve cannot be undone. We cannot, with any surgery or medication, we cannot undo the damage that glaucoma causes. So the only way to really manage it is to detect it early using measurement of pressures and looking at the nerve, and then to treat it with medication and bring those pressures down with medication, so that further deterioration doesn't happen. Because we can prevent further deterioration, but we cannot reverse deterioration that has happened. So that's why it's extremely important to get yourselves checked routinely, because you wouldn't know by yourself that you have glaucoma. And especially for somebody who has a family history of glaucoma,
Yeah, exactly.
extremely important to get yourselves checked every year, so that if you do develop signs of glaucoma, you're treated early on. In most cases it can just be treated with drops. The pressures can be brought down so that further deterioration doesn't happen. In rare cases where the pressures are extremely high and we are not able to bring down those pressures with drops, we do advise surgeries, and in those cases surgeries have to be done, but not in most cases.
Okay, so like it cannot be stopped until unless it is not detected at or
Absolutely.
diagnosed at the earlier stage, right?
Absolutely. Yes.
And one should always get, after like 40 years, you should go for a regular checkup. That's like
After the age
the
of
tip
40 years,
of
a yearly
this. Yeah.
examination is extremely important, because it's not just for glaucoma, but for a lot of other things
Okay.
which are hidden and which you might not find. And if they're detected early, they can be treated, and but if they're not detected early, then you might have irreversible loss of vision.
Okay. So it's like a age-related problem that you end up having in for 40s or middle age
In
people, I
most
think.
individuals,
Or
yes. Again,
is it common in even in younger people?
yeah, it is most common in people above the age of 40, but again, like with cataract, there are exceptions. There are some individuals
Okay.
who are born with glaucoma, because the mechanism for draining the
Oh,
fluid in the eye is not well developed, so they can have high pressures at birth as well. And again, steroids can cause high pressures. Somebody who's had trauma can have high pressures. So there are exceptions, and younger individuals also can have this thing, glaucoma, but essentially most commonly it is in people above the age of 40.
okay. So like any specific diet modification one has to do when suffering from glaucoma or something like that?
No, no. The only way to reduce pressures in the eye is with drops. So diet modification, like I said, it's important. A healthy eye lives in a healthy body, so it's important to have a good diet for general ocular health. But as such, specifically with glaucoma, there's nothing that diet
Okay.
can do.